Hi, my name is Rhea Dala, and I'm a junior in high school, and my research paper was about regional disparities in type 2 diabetes and cardiovascular disease prevalence, and then identifying key lifestyle factors and prevention strategies. So in my paper, I was investigating regional disparities and identifying lifestyle changes and prevention strategies to reduce type 2 diabetes and cardiovascular disease prevalence. So regional disparities, it basically means when a region lacks resources or development, and then I tied it in to how it could affect the development of type 2 diabetes and or cardiovascular disease prevalence. And I thought this was important to investigate so that doctors and others can provide effective health strategies for type 2 diabetes and cardiovascular disease prevention. And something to know is that when someone has type 2 diabetes, it leads to high glucose levels in their blood, which can cause clogged arteries, and this can accelerate the development of cardiovascular disease. And so the objective of my paper is so people can learn about the two diseases itself, learn about the prevalence of them worldwide, and then see if there's a common trend between those who get this disease. And so then others, and then the people who may have either of these diseases or both can prevent themselves from getting type 2 diabetes or cardiovascular disease, or just if someone has it, then they can learn on how to improve their lifestyle so it doesn't worsen. So many articles talked about how those with type 2 diabetes are more prone to different cardiovascular diseases. And again, so this is because both of these diseases share many common risk factors, such as hypertension, atherosclerosis, lack of exercise, poor lifestyle decisions, and much more. And so improving your diet, such as adding more vegetables and fruits and greens into your diet and reducing the content of sugar and fat into your diet will be a big step into helping those who have these diseases or are prone to getting these diseases. And then there were also a surplus of articles which proposed ways on how to do these things. So while I was researching about my topic, I made sure to get information from organizations such as the Mayo Clinic and other trusted companies, and then I used multiple different articles from all of these different organizations to ensure that all of my information in my research paper was accurate and none of it was false information. And then the results from my data show that those who develop type 2 diabetes when they're older are more likely to develop a cardiovascular disease later on. So how can regional disparities affect the development of type 2 diabetes and cardiovascular disease? And then furthermore, what are some lifestyle changes to implement into your daily life to prevent both diseases? So again, regional disparities, it involves when a region has a lack of resources or development, and then tying it into how it could affect those who live in places like that, and how it can cause them to get both of these diseases. And then I contributed lots of information supporting my thesis from a wide variety of resources. Thank you.